नमस्कार। इंडिपेंडेंट रिसर्च एथिक्स सोसाइटी की आयुष समृद्धि इंटरनेशनल वेबिनार सीरीज के 2268वें अंक में आप सभी का हार्दिक स्वागत। हमारे साथ आज डॉक्टर आशीष फड़के जी, जो क्लिनिकल हिप्नोथेरेपिस्ट हैं, चीफ आयुर्वेदा एंड योगा कंसल्टेंट हैं, जिनका खुद का आयुर्विजन सेंटर फॉर आयुर्वेदा एंड पंचकर्म थेरेपी है नवी मुंबई में। मैं उनका हार्दिक स्वागत करता हूं। किरण जी भी संभवतः जुड़ेंगे। ब्लाइंडनेस आज बढ़ती जा रही है, और जब से ये रेडिएशन आया मोबाइल का, तब से तो आप कल्पना न करें कितनी बढ़ती जा रही। तो इसके लिए हमें निश्चित है कि कुछ न कुछ उपाय जरूर करने होंगे। और ये हम जन सामान्य के लिए, यूट्यूब के दर्शकों के लिए जो ये श्रृंखला कर रहे हैं आयुष समृद्धि की, निश्चय ही उनको लाभकारी रहेगा। मैं ज्यादा समय नष्ट न करते हुए डॉक्टर विष्णु प्रसाद शर्मा जी को सादर आमंत्रित करता हूं उनके स्वागत प्रवचन के लिए।
Namaskar. Good evening to everybody. Hariom. Respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to AYUSH SAMRIDDHI International Webinar Series on Tips to Prevent Blindness. In this webinar, we have eminent speaker. I want to welcome Dr. Ashish Fatke.
Namaste, sir.
Namaste, namaste. Clinical hypnotherapist, chief Ayurveda and yoga consultant from Ayurveda Center for Ayurveda and Panchakarma Therapy from Navi, Mumbai. Namaskar, sir, and welcome you to this AYUSH Samriddhi webinar. Next, I want to welcome Dr. Kiran Patil from Kolkata. Namaskar, sir, and welcome you to this AYUSH Samriddhi webinar. Once again, I welcome all the eminent speaker, distinguished guests, ladies and gentlemen. सबको स्वागत करते हूँ आयुष समृद्धि इंटरनेशनल वेबिनार सीरीज ऑन टिप्स टू प्रिवेंट ब्लाइंडनेस। सबका स्वागत करते हूँ। नमस्कार। ओवर टू पवन जी।
बहुत बहुत आभार सर आपका। मैं समय नष्ट न करते हुए आदरणीय आशीष जी को सादर आमंत्रित करता हूं उनके आशीर्वचन।
First of all, let me thanks Dr. Pawan Kumar sir for giving me an opportunity to be with you. Usually whenever there is something pertaining to eye, so definitely he calls me. So in the same series, I am here in front of all of you. आज का जो विषय है वो पर्टिकुलरली प्रिवेंशन ऑफ ब्लाइंडनेस ऐसा दिया है। यहाँ कोई आयुर्वेद का विशेष जिक्र नहीं किया, अभी तो उसके ऊपर भी संक्षेप में अंतिम में बात होगी। मगर जो मेन चर्चा होगी वो क्या स्ट्रैटेजीज है और क्या सिनेरियो है आज के युग में, आज के परिप्रेक्ष्य में, आज के समय में। तो वी ऑल मस्ट बी नोइंग दैट बेसिकली ये जो ब्लाइंडनेस है ये एक बड़ा भयंकर संकट है। और वो जानने के पहले वो क्या है वो तो हम सब जानते हैं, बट उससे पहले आई वुड जस्ट मेक यू अवेयर अबाउट वन मोर थिंग कि किसे पर से हम ब्लाइंडनेस कहते हैं, राइट? बिकॉज इन द क्लिनिकल सेटअप व्हेन वी चेक पेशेंट्स you see people coming out with some visual disturbances, blurring of vision. तो हम सबने देखा है, हम सबने पढ़ा है इन आवर अंडरग्रेड स्टडीज कि भाई 6/60, 6/36, 6/18, 6/12 या 6/9, 6/6. तो 6/6 is considered to be normal vision for a common person. 6/6 is a नॉर्मल विजन। 6/5 6/4 भी होता है और चेक करते हैं, दैट इज पर्टिकुलरली फॉर डिफेंस एंड पर्टिकुलरली फॉर रेलवेज एंड नेवी, ऐसे पर्सनल के लिए उन्होंने स्पेसिफाई कर रखा है। बट देन व्हेन वी सी कि विजुअल एक्यूटी लेस देन 3/60 है, तो उसके और या तो उसके इक्विवेलेंट है, फिंगर काउंट में आ जाता है लगभग, तो ऐसे कंडीशन में इट इज टर्म टू बी blindness. So it is inability to count fingers in daylight at a distance of 3 meters. So यहाँ व्यक्ति बैठा है, रुकना बैठा है और बीच का अंतर 3 मीटर है और वहां से उसने फिंगर काउंट नहीं चेक पर कर पा रहा है, नहीं बता पा रहा है, तो उसका मतलब आता है 3/60। एंड ये जो कंडीशन है इसको क्लिनिकली इट इज कंफर्म्ड एज डिफाइंड एज ब्लाइंडनेस। ओके, whereas ब्लाइंडनेस के अलावा देर आर अदर कैटेगरीज ऑल्सो, जैसे वी कैन सी वी हैव गॉट समथिंग नोन एज लो विजन। सो लो विजन में देर इज अ मैक्सिमा एंड मिनिमम, तो किसको मैक्सिमम है तो लो विजन कर सकते हैं, तो उसका एक उन्होंने परिमाण दिया है। तो उसमें क्या बताया है कि अगर इट इज लेस देन 618, ओके, एंड सॉरी मोर देन 618 एंड लेस देन 660, देन इट इज लो विजन करके उनको वर्णन आता है, उनका कैटेगरी उसमें रखी जाती है। या 660 टू 3/60, मतलब 3/60 हमने अभी देखा था ब्लाइंडनेस के लिए उन्होंने वर्णन दिया था। बट इफ इट इज अप टू दैट, मतलब वो चीज में ही वो आ जाता है, तो उसको भी हम लोग कह सकते हैं कि ये लो विजन एड है। बट अदरवाइज ये जो मैंने पहले दो बताए, ये लो विजन में, लो विजुअल एड में बताए जाते हैं कि इसको ये कहते हैं। देन ब्लाइंडनेस को लेस देन 360 और मोर देन और मिनिमम और इक्विवेलेंट टू 1/60, मतलब फिंगर काउंट एट 1 मीटर, या 1/60 दैट इज फिंगर काउंट एट 1 मीटर, और just perception of light, that person is not even able to count fingers। आप आंख बंद करके पूछते हो भाई कितना दिख रहा है, तो वो भी नहीं बता पा रहा है बंदा, बट he can perceive light if you throw light from torch in a like closed room, in a dark room, and if he is able to say that, then that also is considered, light perception is also considered as blindness। And the last one is no light perception, मतलब बिल्कुल उसको दिखता ही नहीं है, तो वो भी ब्लाइंडनेस में कवर होता है। तो बाय डेफिनेशन नो लाइट परसेप्शन टू इक्विवेलेंट टू 3/60, दैट कम्स अंडर ब्लाइंडनेस। लो विजन इज गोइंग अबव 3/60 अप टू 6/18, तो ये ध्यान में रखना जरूरी है। देन what next we must know is with regards to the problem statement, क्या है उसका। तो आज के युग में, आज के समय में around 180 million people are visually disabled, nearly 45 millions are blind, and 4 out of 5 living in developing countries like India, though it is going to shift the position from developing to developed country, but still in within India the percentage of blindness is far more. So 4 out of 5 living in developing country, it is found out to have this problem. What are the major causes? The causes are like cataract, glaucoma, trachoma, childhood blindness. Then there are many other conditions, right? Around 32% are aged between 45 to 59 years. ध्यान दीजिए, 32% patients are between the age of 45 to 59. Now, considering India's population, India's scenario, our age for retirement is 58. तो ये 58 के पहले ही 45 ईयर्स से चालू हो जाता है, तो यू कैन इमेजिन व्हाट इज द कंसिक्वेंस of this with regards to these people. And large majority, that is 58%, are over 60 years of age. 58% ये 60 साल के ऊपर के है। Then SEAR has 1/3 of the world blind population, 50% of the world blind children. तो इसमें आप देख सकते हो कि ये अलग अलग वे से इसको we can understand, we can have a look at it. Then सबसे important है कि within India, what is the percentage of all these different causes or all these different diseases which we have just now spoken about. तो इसमें causes of blindness में सबसे ज्यादा cause 62.6%, more with the advancing age senile cataract that is happening. So cataract takes the first position, that is around 62.6%. नीचो नीच अनकरेक्टेड रिफ्रैक्टिव एरर, मतलब चश्मे का नंबर बराबर से चेक नहीं होना, या चश्मा लेना ही नहीं, या है तो चेक नहीं करना एट रेगुलर टाइम इंटरवल, उसकी वजह से भी कम दिखाई देना ये स्वाभाविक रूप से दिखाई देता है. ग्लूकोमा, जिसको हम अधिमंत कहते हैं या झामर कहते हैं गुजराती में, so that glaucoma is counting for 5.8% of the population. And this is incidence. Incidence itna hai. Then posterior segmental pathology, जिसमें you can see vitreal rupture या retinal detachment या और भी choroiditis and all that. So that goes to the percent of 4.7. Then anterior segment में, anterior chamber में, you can see corneal opacity, and which is again very major issue, and you can see it's around 0.9%. दो इट लुक्स कि ये कम है, बट फिर भी अगर पॉपुलेशन टोटल देखे तो उसके हिसाब से इसका नंबर भी काफी ज्यादा है. एंड वी आर लकी बिकॉज every year we do conduct some kind of webinar on corneal transplant, या आई डोनेशन के ऊपर भी कई सारी वेबिनार हम लोग ने प्रस्तुत की है, तो वहां उसका ज्यादा महत्व है. And other injuries, if somebody is getting hit by some kind of other injuries, so that counts to 6.2. And then cottage industry, then carpentry, blacksmithy, stone crushing, all that, yeah, chiseling, all that counts to 1.2%. So this is what is the total iska jo differentiation hai that we can see. Now, what are the changing concepts in this particular category? So isme we have to see that what basically we are trying to understand is basically you require to create national establishment of national level program, and what that program is we will be discussing a little later. Then there is something known as team concept. So many people, they come from the different profession and they come together and they conduct particular survey or particular program, and that team concept is also coming into play, and that is also very important. Okay, then epidemiological approach. So measurement of incidence, then prevalence and risk factor of disease. That is also undertaken by various agencies, different agencies within India. I'm all these I'm saying with reference to modern medicine, right? Then primary eye care क्या हो सकती है, उसके ऊपर भी बहुत ज्यादा विस्तृत रूप से people are thinking about it, and they are trying to put their inputs and giving them some kind of help and going ahead with. So all that is a different way in which they are going ahead with. Okay, then what other thing which we must know in this particular thing is about one sec about mainly trachoma and vitamin A deficiency. These are one of the important factors, trachoma and particularly vitamin A deficiency, for example, because if you pick up cases which are not able to see in the late evening or in the night particularly, and then if you observe that bitot spots which is there inside your eye, a white spot in the side of limbus, if you can see. Then if you give appropriate vitamin A supplement to that particular patient, then you can see that that vision which is falling is can be reversed back to the normalcy. And that is what is very easy way. But the important factor over here is we should train our primary health physicians. So those who are working as a general, general practitioner, right, family physicians, if they are aware and if they pick up such kind of people, then even without sending them to tertiary level or secondary level, they can just give vitamin A supplement from their armamentum, and that can help. Now the question would arise, okay, that is fine, that we know that there are tablets and so international unit vitamin A has to be given, that's fine. Is there anything from Ayurvedic side? Say in Ayurveda, what we can do is we know Shigru, and Shigru is again well-known drug in our use. So I remember we used to suggest our patient, even in my practice, I do suggest that you can have Shigru Patra Swaras. So one can just ingest, or you can do in certain, not in all cases, in particular small niche, kind of cases, we do Shigru Swaras Tarpan also. Okay, but then yeah, Shigru Grita, that is also to be taken into use. And the another thing, now we are in the month of April. Now it is 2nd April, and what is the main attraction in April May? In Maharashtra, at least, we look forward for eating mangoes, and mango is one of the fruit which is full of vitamin A. So if you ask them to eat something which is containing vitamin A, so that will also take care, but definitely you have to think about giving supplements as well. Okay, now coming down to another aspect, that is strategies. So on all India basis, our government has initiated a program known as National Program for Preventing Blindness, right, NCPB. And in that, preventing blindness in India requires a multifaceted approach, and considering the country's diverse population and healthcare challenges. And to know that or to address that, we have to understand certain areas in a broad way. I'm not getting into great details, but in a broad way. So what are those? So strengthening primary eye care services. So integration of PHCs, like primary health services or primary health centers, and to train them, training general healthcare workers along with them in basic eye screening, like can help in early detection of many common conditions. Like just now I spoke about night blindness due to vitamin A deficiency, so that is one of them. Or just to screen and check out whether that person is approaching towards cataract, and if you know, then you can keep a record, and then at appropriate time interval you can connect to those people and then work with them. So that is one of the best way. Then mobile eye clinics, nowadays there is a new concept that mobile van equipped with ophthalmic equipments, may it be slit lamp examination, may it be indirect ophthalmoscopy or Snellen chart. And in those vans, I've seen one of my colleague is conducting that in Mumbai and Navi Mumbai. So he has, put solar panel on that van, and all the equipments in that particular van, they are working on the electricity generated through that solar panel. So this is something really good, and you can take that particular mobile van to remote places. And why only remote places? In Mumbai particularly, we have got a lot of slums. So you can go to slum, you can announce that we are going to conduct camp, and in that you can just screen the basic screening. If required, you can give refractive errors, you can check and give away glasses. And specific conditions, like specific condition which require surgical intervention, you can call those people to secondary or tertiary level centers where we can do further work. So that is what is strengthening the primary healthcare or eye care services. Then addressing key causes of blindness. So addressing key causes, one of the key cause already we have discussed earlier, that is what is cataract. And we have to actually do some kind of public awareness programs or campaigning, and we have to tell that this is nothing wrong, and you have to just come down to government sector or private sector, whichever is convenient for them, and get it operated. Nowadays, once upon a time when I was working left and right in modern ophthalmic hospital, we never had kind of like IOL transplant those days, intraocular lens transplant. So we have to check patient, you have to do the surgery with 3 to 9 कट लेके अंदर से लेंस को डिलीवर करना है, cataract निकालना है, and then you do suturing, then you have to call patient next day, then third day, and all that, remove sutures and all that stuff, and finally you have to give glasses. And I still remember people, those who can't see for a long time, and when you have been given those particular aphakic glasses, the thick one, plus 10 plus 12, and the kind of happiness on their face the moment they wear the glass, and when we ask, come on bhaiya padho, aap kuch dikh sakta hai kya, and when he can see that big letter E or D and or whatever, 660 636, then they are very happy. So that kind of programs, awareness program, we have to conduct. We have to make awareness from the school level also, and in the various societies and society, then other groups, NGOs and all. Then refractive error management programs are again a very common program in metro city like Mumbai, Delhi, Calcutta, and Chennai, and other major cities as well. And there we take a team over there. Then people, they screen masses and they check their vision, and if there is requirement, then we give them free or very minimal cost spectacles. Many times they are not having any distance vision problem, only presbyopic correction. After 40s, you get to have presbyopic correction. So that, and that kind of thing will also help you to prevent blindness on a larger scale. Okay. Then diabetic retinopathy screening, because India is a world capital of diabetes nowadays, unfortunately, right? And the long-term result of diabetes is also leading towards, one of the complication is diabetic retinopathy, and that leads to blindness. So if you can attain, or if you can approach some groups which are specifically working on diabetes, so in collaboration with those diabetologists or the societies which are working for diabetes per se, then you can screen their retinas with the simple fundoscopy, and then you can pick up some of those cases and then take them further for either treatment or for intervention with lasers or another surgical intervention if required, and that can prevent further blindness, which is very very crucial. Okay. Then glaucoma awareness and treatment programs. So glaucoma is basically nothing but adimanta, as I said, where the intraocular pressure increases in those particular cases. Okay, so you have to check the intraocular pressure of those particular patients with the help of appropriate technology, may it be direct or indirect, tonometry, a planation tonometer we can use, and we can check, and then you can start appropriate medicines in the form of eye drops, in the form of tablets, and see to it that the eye pressure is coming under control, and then it is not getting problem. Or otherwise, if you don't do this, then the eye pressure will go up, and then the optic cup which is formed because of the pressure will increase, and as a resultant, you see that these people, they have got blind spots. When I'm looking at you, I can see everything in front of my field, in front of my visual field per se, but then in those cases they can't see particular zones, and that becomes dark black, and that is known as scotomas. So those scotomas once formed, then it is irreversible. So friends, we have to be very, very careful, and we have to be very upfront in telling patient that please don't stop those medicines unless and until your doctor is suggesting that way, right? And you have to check glaucoma, you have to check eye pressure, and you have to control your BP, because BP if increases, that has got direct relationship with this. So all those do's and don'ts we have to explain. And the final one is corneal blindness, and that can happen because of corneal opacities, corneal ulcers. And if it is found, then you have to treat that particular person and then refer it to appropriate center, once again tertiary level center, where they can register themselves for corneal transplant. And then if he or she, that patient, is lucky to get graft ready for him or her, then that can be done, and one can save that person's eye and can prevent blindness in a larger way. So these are another major things. Then enhancing awareness and preventive measures by public awareness campaigning, school vision screening, and nutritional interventions. So all these are important with reference to children, with reference to common people. Then improving eye care infrastructure. So upgrading district and taluka level hospitals, ensuring all district have at least one well-equipped eye care center or OPD at least. Okay. Then strengthening human resources, because you may not get that number of trained ophthalmologists, but then you can also try to create structures whereby you can create of properly trained 4 years 5 years trained optometrists, those who get degree B optom. Okay. Or they can go ahead and do final PhD OD, doctorate in optometry. In US and all, they do have. In India now they have started masters. Maybe few years later you can also hear OD, like PhD. And there are other vision technicians, visual field technicians, or electrophysiology technicians, those who are utilized for the eye checkups, advanced eye checkups. So those are also required. Or basically radiologists, or sonographer, or a CT scan, you do OCTs and all. So those kind of personnel need to be put to practice. Then encouraging public private partnership, PPS. So you can ask to get collaborate your NGOs or societies with that of hospitals or with that of government sector clinics, and that can undertake better different kinds of activities. Then government initiatives and policies, so national program for control of blindness, that is NCPB, already I mentioned about it, is doing a great job, okay, already. Then health insurance coverage for eye care, people, they get little hesitate to go and get operated, because many of them they feel, is it possible? Because in Mumbai, in a city like Mumbai, if you want to get operated for cataract with intraocular lens, then the cost is going up to 70,000 per eye, 75,000 per eye. And for a common man, middle class person, this is too much. So if it is getting covered under medical insurance, and which is now covered, earlier it was having some issues, but now it is getting under cover. So most of the people, they can go and get it done. Okay. Then incentives for eye care innovations. So let technologies come ahead and do some innovations in this particular regard. For example, I give example of like electronic chip, which is prepared and it has been inserted, so that a person's retina, if it is not working, then through this particular chip a person will be able to sense. So that is kind of innovation. So, or in low vision aid, we give them telescopic lenses. Now nowadays telescopic lenses we all are aware, but once upon a time it was an innovation. So that kind of stuff is also been pushed forward by government agencies and policies. In strengthening eye donations and transplantation, already I mentioned that we are doing a great job on our platform. We do at least one or two sessions or webinars on eye donation, and you have to work for promoting eye donation by public awareness campaign and expanding eye banks so that people can go and donate their eyes, like, because those who are willing to donate, they are already died, but then the relatives have to communicate to, and then they will come and pick up the corneas and take it in a safe way and appropriate way so that it can be utilized. Then leveraging technology for eye care. So nowadays there is another area which is upcoming, that is tele ophthalmology, like telemedicine. It's a tele ophthalmology. So you are sitting at X place, maybe in cities, and the primary healthcare person is trained how to pick up the signs and symptoms, and then he will send it across your internet, and the person who is sitting in the tertiary hospital, he can diagnose and suggest the treatment part. That is tele ophthalmology. And then AI based eye screening. So artificial intelligence based eye screening, this is the upcoming thing. So by just scanning, you can understand, oh, this fellow has got this. Now last to last year, I suppose, I remember, in your Apple phone, not in our Samsung and all, but Apple Android, they have come out with particular app that you just screen the retina, and it will tell you that, oh, it has got, say, early stage of diabetic retinopathy or hypertensive retinopathy or things like that. So all that AI applications can also be utilized. Now, apart from this, if time is there, then I'll speak. Otherwise, already we have taken a lot of time. But then you please remember common things like trifla a day, or half a spoon trifla or 1 spoon trifla at night, or particularly 7:30. You can take along with honey and ghee, provided you don't have diabetes, high level diabetes. Otherwise, you can just take trifla. Okay, that will take care of your eye. Saptamrutlo is another very good combination, but please take it with the guidance of your Ayurvedic consultant. Okay, then there is trifla grut, mahatrifla grut. Okay, or the shatavari grut, many other things. And we suggest that if you do nasya, pratimarsha nasya means you just take a few drops of sesame oil and just apply inside your nostril and pull it inside. That alone can also be helpful for your ocular health. And rasanjan, the use of rasanjan or saviranjan, that will be also useful. I think with that, an avla day keeps doctors awake, keeps ophthalmologists also awake. So avla day is a very important tip for all of us. With that, I rest here. I think I had tried to cover almost all points with regards to prevention of blindness on national level, and with most possible updates. Thank you very much.
थैंक यू वेरी मच आशीष जी। आप जब भी बोलते हैं बड़ा लॉजिकल, साइंटिफिक और वेल सेल्फ एक्सप्लेनेटरी, ग्रेट।
Thank you.
बहुत अच्छा बोलते, जुड़ते रहिएगा। आज संयोग से लेट हो गई वेबिनार, गुरुजी के कारण, लाफिंग गुरुजी के कारण। मैंने कहा ठीक है, फड़के जी का टाइम आ गया। बहुत अच्छा हुआ। थैंक यू वेरी
Thank you.
मच। मैं डॉक्टर निशांत शुक्ला जी कंफर्टेबल हैं क्या? निशांत जी, कंक्लूडिंग रिमार्क्स। आदरणीय सीपी शर्मा जी भी हमारे साथ है। मेरी आवाज ऑडिबल है? चलिए, बहुत बहुत आभार आपका। आज प्रिवेंशन ऑफ ब्लाइंडनेस वीक है, बहुत ही अच्छा दिन था। और दूसरी बात, ये एमएस ने तो मेरे को बहुत ही अजीब सी प्रॉब्लम में डाल रखा है। मल्टीपल